This tutorial presents the content of the module Communicating with Parents as part of the IO2 Erasmus Plus project, SoftisPed, Soft Skills for Children's Health, funded by the European Commission. During the medical examinations, doctors and parents should understand each other. Without this, there won't be a mutual confidence. This kind of relationship is really complex. There are cognitive and affective barriers in the communication. To ensure good communication between parents and healthcare providers, it's necessary to understand what parents consider important about doctor-patient-parent relationships and what are the most critical points of medical encounters. This chapter presents the base of the relationship between doctors and parents and will show how this can be improved by communication skills. The chapter will discuss the transparency of information about treatment and therapy, communicating with parents, and soft skills. There are practical assignments and case studies assigned to this chapter as well as a few control questions. Healthcare quality level is largely dependent on safety, timeliness, effectiveness, efficiency, equity, and good communication between healthcare worker and patient. To provide professional and patient-centered healthcare service, improvement of communication skills is essential. Patient-centeredness can also be defined as a biopsychosocial approach to medical treatment. The biopsychosocial model, in contrast to the biomedical model, states that health and diseases are determined by a dynamic interaction between biological, psychological, and social factors, and no single illness, patient, or condition can be reduced to any one aspect. As opposed to this, the biomedical model attributes illness to biological factors, such as viruses, genes, or somatic abnormalities. In the literature there are four basic forms of doctor-patient relationship: paternalistic, mutualistic, consumerist, and default. In this chapter all four types will discuss in details. Communication barriers mean all those blocks which stop or interrupt the process of communication. There are many hurdles to good communication in the doctor-parent relationship, including cognitive and affective barriers. To reach the common goal of better child health, the physician needs to identify the most common communication barriers and learn certain soft skills besides the medical knowledge he holds. The chapter will pay attention both to the cognitive and affective barriers. The pediatrician-parent-patient relationship is built on trust. The most important predictive factors of effective communication between physicians and patients' parents are the perception of interest, caring, warmth, and responsiveness. Trust during pediatric encounters is generally defined as a parent's belief that the pediatric healthcare provider has their child's best interest in mind. Bad relationship with practitioners is the main source of parents' criticism. Good relationship has a greater influence on patient satisfaction, patient recall, and treatment adherence than written instructions or even the time of the medical encounter. In the chapter, attributes like clarity, directness, honesty, respect, listening, openness, benefit and risks, complementary and alternative medicine will be discussed. Parents' role in the doctor-child communication varies according to the child's age. Up to the age of 6 to 7, the parent is the person who can communicate better and functions as a main translator of the child's symptoms, questions, and wishes in general. Around the age of 6 to 7-year-old children can provide a better description of their symptoms than their parents. In the age group of 6-12-year-old children, parents' role consists mainly of encouraging the child to communicate directly with the doctor, telling the symptoms in his own words, providing help when needed. The triadic communication, in contrast with the dyadic communication, will be highlighted. The most important soft skills are patience and listening, shared attention, multitasking, empathy and emotional intelligence, managing emotions, solving things, bad news, simple language, expressive communication, repetition. Listening well is an essential part of communication. This requires the provision of adequate time and patience, and the willingness to listen to parents' concern. A quiet room, lack of interruptions, provision of chairs for the parents, sitting at an appropriate distance, good eye contact, etc., are helpful to enhance listening and learning from the parents. parents of sick children are going through a difficult experience. Because pediatricians interact with both kids and their parents, they need especially strong interpersonal skills. Bonding with the child's family, showing empathy and understanding the parent's plight is a very important part of the treatment. Parents can react in various ways to stressful situations, and a pediatrician must be prepared to handle common negative reactions like blame, anger, a sudden outpouring of grief. Not all parents have a good educational and intelligence level. Explaining things in simple, clear, and direct language is very important. Clarity and directness are particularly important with parents of limited health literacy. Most patients are not familiar with the medical terms, and 89 to 93% of doctors fail to check if they understood the explanation or not. Therefore, patients memorize only 50 to 60% of the information provided. Parents may have trouble following dosing and care instructions, calculating the correct amount of medication to take, and reading nutrition labels. Simple language is a strategy that can be applied on both written and verbal communication. To make sure that the parent will understand the information provided, first the pediatrician should check what the parents already know about their child's illness. A lot of parents visit sources without review or control, like websites or health magazines. Parents' comprehension abilities might be influenced by language problems as well as emotional states. Pacing the information, providing it in a logical sequence or breaking it into 2 or more sessions can result in improved understanding and better information retention. Between 2 sessions, parents have time to absorb the information and cope with the new situation. Pediatricians should be prepared to patiently repeat information and answer questions. It's also important to pay attention to how much information the parents want to know. 5 practical activities and 4 case studies join the training material. At the end of this chapter you will find a short MCQ test. Fill the test and check your knowledge. We do hope you will pass the test with success.